a lot of the work, not just in Hong Kong but across the region, is still quite paper-based.
I would not say that Hong Kong is underdeveloped, but is maybe also not leading.
The healthcare ecosystem across the region is developing rapidly, particularly with new technologies arriving. But I think as a healthcare industry, we're actually a long way from that.
Which locations, countries are pushing more than others? Do you see a bit of a difference?
Singapore, I think, probably the most progressed in terms of being more patient-centric, population health focused, and putting policies and regulations in place. Hong Kong has a bit more to do.
What do you see as key core trends in the next 5-10 years?
It's a time of transformation. Insurers could definitely do better, not just selling more, but actually improving the customer experience and improving health outcomes for their customers. I think it's an exciting time for the industry.
Welcome to the Pulse Check podcast. Damian Delaney, thank you for joining me.
Thanks, Salomon. Thanks for being here, and great for your time.
Yeah, and we've met very frequently in the past few months. You've joined Synpulse as a senior advisor with extensive experience in the industry. So really looking forward to have the conversation with you today. But before we go into the topic, the hard elements of the healthcare industry, I would love to ask my basic question.
Sure.
Damian, so what defines you? What makes you you?
What makes me me? Well, you know, I take pride and passion in the work that I do, that I've done across the last 30 years in financial services, in banking, healthcare and insurance. But personally, my family defines me, and my wife, my daughter, my son, fantastic. Little thing that people don't know much about me is actually I used to be a competitive ballroom and Latin dancer.
Oh, wow.
Yeah, I love all sports. I play all sports, but actually back in the day, my mother got me into it, and it was an exciting chapter in my life. But it's a little known fact.
Okay, so need to go for a dance club next time. Go for drinks. So
it's a long time ago now.
No, but what I love about you is the passion that comes definitely also through.
Sure.
When we work on business topics. So sometimes we lose passion a bit in the financial services industry, but it's a core element. So coming into the topic of today, of course, especially the past 5-10 years, you've spent significant time in the health insurance, healthcare industry. That's also a topic that is close to my heart. Besides the fact, of course, it's part of our business as consultant. It's also part of our life. I do a lot of sports. I'm a runner. Yeah. So, of course, once in a while I have an accident and I need to go straight to the hospital. In Hong Kong, of course, it's great. You can just walk into the hospital. So basic medical care is covered. Then, of course, you come to more extensive care. And then, of course, there could be also very significant health issues where I'm sure everyone wants to be well protected. I also find it a bit difficult in Hong Kong compared to other markets when it comes to digital healthcare applications and systems. I would not say that Hong Kong is underdeveloped, but is maybe also not leading. I know you're expert not only in Hong Kong, but across Asia. So I would love to start with a bit of the digitization of the healthcare ecosystem. What is the state today, but also where does it go? Where do you see developments?
Yeah, I think the healthcare ecosystem across the region is developing rapidly. I think that the pace of that change has never been faster, particularly with new technologies arriving, artificial intelligence, generative AI, agentic AI, where you've actually got applications that are going to be collaborating with each other with very little human interaction. All that sort of is quite progressive, but I think as an industry, as a healthcare industry, we're actually not quite, a long way from that just yet. I think even the foundations around digitalization of data warehouse or data structures, collating data, a lot of the work, particularly not just in Hong Kong, but across the region, is still quite paper-based. And I think that challenge to digitize even the most core of systems, the core of processes is still underway, and organizations are still working through that journey. Now, the bigger players, of course, that I've worked with, the top 3 life, accident, and health insurers across the region, they're a little more progressed than others, but still quite a long way from where they want to be. There's a global trend of becoming, not just a payer, but a partner in health. And to do that, digital is the way to do that at scale. And helping organizations on their transformation journey is one of the reasons why I'm collaborating with Synpulse, working with you guys to sort of help organizations address these challenges. But definitely a long way to go. I think the role of data and analytics generally, is still nascent. I think there's some more advanced markets than others. But the big challenge has been around structuring data. I think with AI now, you maybe need less structured data. AI can actually work through your various databases and actually collate information as needed. And I think that's going to be a game changer in terms of both service delivery, operational efficiency, customer experience, and innovation around products and policies that where we can cover new patients and new segments. But like anything, I always say, data isn't anything without insights, and insights nothing without action. And I think that's one of the challenges the industry faces, to sort of take those insights, put it into action in various ways. And I think that skill set and that talent pool to do that effectively is still developing, quite young.
So where do you see the biggest growth driver in the geography in Asia, or maybe even global? You had global roles. Which locations, countries are pushing more than others? Do you see a bit of a difference?
Yeah, I definitely see, obviously, Hong Kong, Singapore as a little more progressive. Singapore, I think, probably the most progressed in terms of being more patient-centric, population health-focused, and putting policies and regulations in place that drive the right behaviors and align incentives. There is an industry-wide issue of misalignment of incentives. It is after all, in the private sector, a for-profit sector. And I think that challenge, raises its head across all markets. I think Singapore's been quite progressive in the way it regulates and approaches that challenge. Hong Kong has a bit more to do. It's quite a strong sort of doctors' lobby association, that have vested interest in the way things are done today. And I think that can be challenging for insurers as we try and offer policyholders effective coverage at a reasonable and sustainable price. Price of coverage, medical inflation, premium inflation is a regional issue. It is, on average, between 7 and 15% on an annual basis. Now that's driven by a number of factors. Some, yes, it's advancement of technology, it's new drugs, it's new treatments, but a lot of it is administrative costs that perhaps you could do less of or be more efficient with. And hopefully with technology, adopting technology, maybe putting care pathways and gateways in place to sort of, minimize access to expensive care that may or may not be necessary. If it's not necessary, then it's really up to the insurer to help policyholders sort of, navigate the system and understand the system, and even advocate for policyholders in their care pathway, in their care journeys. So I think this is it's an evolving area that other markets like Europe or other markets like the US, I think they do a little more in terms of guiding patients through care pathways, through concierge services and care management programs, complex claims management. That's still not so well understood or executed here across the region.
It's an interesting element because I'm just thinking of my own experience. Again, I do a lot of sports running where I sometimes also need to do health checkups. Sometimes it's even mandatory to sign up for a long distance race. And I then go to a private doctor that we are good friends with because my wife is there already in that practice for a long time. I could go anywhere, but anyway, I go there and then they sometimes also mentioned, maybe your insurance doesn't even cover what we're doing, but then again, checkup is affordable. But I always feel like, I mean, if you go while you're healthy for a checkup, you're in good mood, right? That's also a bit easier to then enroll, of course, an insurance. That's probably when the insurance would be more than happy to take you, rather than if suddenly you're very sick and or you had an accident or whatever. So you're in a good spirit, in a good happy moment, and that maybe you would then even, similar to when you buy a car in the non-life insurance space, when you go into a checkup, that maybe there could be an opportunity to upsell you with certain health protection. That comes back to also that concierge service and what you explained. So nothing happens, right? And it could be digital in a form of following up afterwards when I'm back home, but it could also during the process. So I wonder, why is not more happening in that moment?
Well, I think it's a great point. One of the challenges with health insurance as it's sold today is policies are typically only underwritten upfront one time, not throughout the policy holder's ownership, right? Throughout the duration. So I think with new technologies, there are ways to better manage people's health and well-being through prevention, checkup programs, ongoing monitoring, step counts, activity management programs. You know, there's an influx of those sorts of programs. You know, AIA has Vitality, Prudential has their Pulse app, Manulife has Move, and there's a bunch of others, innovators that are coming through into the market. I think those sorts of programs could be better utilized to actually more effectively, actively, ongoing underwrite or support shifts in policies. So you could actually look to, through good activity and good behaviors, reduce premiums, reduce loadings, reduce excesses, reduce deductibles. All these cost-sharing, out-of-pocket expenses that policyholders are currently hit with, that could be reduced over time with good behavior. Now, there's no insurer that I'm aware of that ever tries to not pay a claim that's a reasonable claim that's within the terms and conditions of the policy. It's really up to the insurer to sort of understand through their medical and clinical experience what's reasonable and customary to treat certain conditions, runners' injuries or whatever it might be. There's a certain criteria of treatment and drugs that are used to solve those issues. So most people don't take the time to actually also read their policies and read the details. And, there's maybe that opaqueness in general in insurance policies generally that can be a frustration for some folks that get disappointed if a certain claim gets rejected. But I don't believe it's the industry practice to not try and pay claims. In fact, they want to pay claims and they want their population healthier for longer. The ultimate goal for the industry is to extend mortality, the time you die, and reduce morbidity, the sickness. So what in layman's terms, that's lifespan and health span. So most people, most policies actually, most claims are paid in the last 10 years of any policy, in the older years of life. Now, what's one of the mega trends that's happening globally, not just in Asia, which is aging population, of course? A rise in chronic disease through lifestyle and, poor behaviors, poor diets, poor exercise habits. That's having a real impact on claims for the industry. But again, I think through new technologies, IoT, Internet of Things, the ability to, improve access to care through virtual means, through telemedicine and the likes, remote monitoring of patients or elderly, folks, through IoT. I think there are all tools to improve efficiency, reduce the opportunity for significant fraud, waste, and abuse, and to improve the overall patient experience and health outcomes. So I think it's really up to the industry to collaborate and to work together with each of the stakeholders to improve those experiences and improve those journeys. But I also think Salomon, you take a lot of responsibility for your own health and well-being. You see it as your own number one priority, and you commit your time and the effort to doing that. Unfortunately, not a lot of people think the same as you. So too often, people, patients, policyholders, however you like to define them, they want the easier way out. They want the quickest solution, the solution that doesn't require them to change behaviors, that doesn't require them to forego life's pleasures, or to take the pain of regular exercise or checkups to get that bad news that maybe you need to catch earlier. If you caught it earlier, it'd be easier and more manageable to deal with. So I think it's there's multiple stakeholders, including the individual themselves, to actually take the responsibility to take care of their own health. But I think the role of the insurer is to really be an advocate for patients and for policyholders in terms of navigating the healthcare ecosystem, navigating their care pathways, their care options, and minimizing the out-of-pocket expenses that they would incur to be treated.
I think the element of a bit of a gamification that started, yes, with the Manulife move and other examples of step counting and so on. I mean, what people love in Hong Kong is to have cash back and those elements. So for sure it would work. And I know a small startup company that has these beacons with what you mentioned, Internet of Things, that you can place on the trails, the big trails in Hong Kong, Maclehose and Hong Kong Trail and so on, where then, for example, if you would pass those on your leisurely hike, you don't need to be immediately a runner. Maybe you could get some scores and good points, brownies, to maybe then also either lower the premium or get some cash back. And then maybe it motivates people. Brings me a bit to the next chapter of this whole drivers for premium medical inflation that, of course, everyone experiences. Premium continuously goes up while you do not feel that you get more services for it. So first of all, again, can we tailor it more towards people actually what they need and that they feel they get also a better service and not just a higher premium?
I think it's one of the ongoing challenges of the industry. I think with medical inflation, as I mentioned, you're running into the double digits. It's not just the private payers that are struggling with that. It's the public payers, the public health systems that are also struggling with that medical inflation challenge. There's definitely a bigger role that a private insurer, life accident health insurer, can take on to reduce the out-of-pocket expenditure that a person would incur to be treated across the region. It's different depending on the market. But that medical inflation, at that level, if that continues unabated, unchallenged, undeterred, I think you have an issue with people not being able to afford premiums, not being able to afford protection. And then they'll fall into the public system, and that public system will, further decline. So I think as an industry, it's really up to us to innovate and to find ways to more creatively, constructively, but sustainably, ensure what is an increasing or aging population, what are segments that have pre-existing conditions that are often excessively loaded or excessively subject to deductibles or even straight out rejected. And there's a certain company in the region that I know that just rejects diabetics straight up, no loading, no nothing. So so that's quite a and you think some of these nations, some of these countries like Malaysia or Indonesia, diabetes incidence is significant. So there's a big swathes of that population that even if they wanted it to be protected, they couldn't get the coverage they want. So this is where I think there's definitely scope for insurtech, health tech players out there who really leverage the combination of data and analytics to segment, to risk stratify populations, to understand who their current at-risk populations are that need to be treated as chronic disease patients, and then the ones that are pre-chronic disease that you identify that you can actually do something about before they become chronic disease patients or chronic disease policyholders and claimants. So I think that opportunity definitely still exists to better use data, analytics, AI, care management, cost containment to help them through that journey. There's a number of policies in Asia that basically only pay on incidents. It's not on indemnity. So, if you were to get a chronic disease like cancer, you get a lump sum payout, $50, $100, $200,000. It's given, the money's just handed over to the policyholder, and they say, well, good luck with that. Yeah. Go and navigate the ecosystem and navigate your own care journey. I think that's where the insurers should do more. I think there's an opportunity to do more through partnerships, through proprietary ownership of provision, or care partners. But that's still a gap in the industry. And I think all of these things will become ways to become partners in health and actually really be seen by policyholders, people as the people they turn to for support when they need it most. Right now, the insurers, I think if you look at the surveys that are done through the research, insurers rank pretty low down the list of trust for people in terms of who to turn to for advice or guidance when it comes to their healthcare, which is a shame because actually they should be up there in the one or two, other than your family GP or your medical practitioner. I think insurers really should be able to build that trust and rapport, to be the first people they call to understand what treatment options are available for the conditions they have.
Yeah, it's maybe also because we always feel if we talk to insurance, we talk to a salesperson. Yeah. But actually the partnership you explained, that of course should not be only with the person who actually sells you the policy, but there's much more in that partnership. And we had, I think, in the past months a conversation around if you also go to the gym and you have a personal trainer, and maybe if he would also be educated, could then create a link in terms of what upselling could be done in terms of insurance. Again, you're in a good moment rather than in a bad moment, and maybe you're open to also increase your protection if you know also that it will help you along the way, even though you may not need it today. So are there ideas and thoughts in that terms in relationship management with
I think it's one of the challenges in the industry. What we have in Asia is a very powerful distribution force in terms of agency, and the big players are primarily driven by agency and or bank partnerships. So the agency force is very powerful, very sales focused. They have to go out there and carve their own path. But there's also some organizations an expectation that same person that identifies the lead, goes and does the sale, is also the one that's supposed to do the servicing, also the one that's supposed to navigate the healthcare ecosystem for their policyholders, because that might give them an upsell or cross-sell opportunity. But in my view, I think it's hard to be that fantastic agent that identifies leads, that sells, that also knows how to navigate the healthcare ecosystem in the best way they can. So I think it's almost up to organizations to better use technology, to better have their own infrastructure internally, where that complex servicing element is actually done by a specialist team, not so much the salesperson that's also the relationship person. So I think there's differing views on the right approach. I think there are players in the market that believe that agents should do everything, and others that believe that they're building that infrastructure around supporting the agency in that care management of that customer or the family.
It's almost like in banking, and you've been on the banking side too, that you have the kind of investment counselor that supports the RM in terms of also the product investment ideas. Right. And here the insurance policy could be similar, right? So kind of a structure, additional protection of what the customer, the client, the policyholder in the end deserves.
And I think on the bank assurance side, which is bank distribution, obviously insurers, the life, accident and health insurers pay significant sums upfront and ongoing for bank partnership distribution. And historically, the area of focus has really been about life savings. It's easier for an RM or an insurance specialist to convert cash or term deposit into a life savings plan or an education savings plan or a retirement savings plan. I think what still is a relatively untapped or undertapped opportunity is that health proposition. How do you sell health solutions to your bank customers? You've got data on that customer and you understand what they're buying through their purchasing of their credit cards or their bank accounts. So there's a lot of data points that you could be utilizing through technology to identify opportunities for triggers to talk about health or to talk about a health instance or health protection. I think that's still an untapped opportunity that needs to be explored further.
So it brings us to probably the last section for today, and it's quite interesting, fascinating. I think we could go on for hours, but maybe the outlook for the next 5 to 10 years, where you see it going. And we talked about technology, of course, now all the time. Definitely Gen AI and so on will play a role. But what do you see as key core trends in the next 5-10 years?
Yeah, I think obviously it's a time of transformation. And I think organizations are all navigating what that looks like for them, what it looks like for their organizations and the journeys that they create for their customers and policyholders. I think a key factor has to be sustainability. How do they not have people drop off the back of an ever increasing premium and being unable to afford cover to going into new segments and opportunities. So I think those who innovate in that space, those who leverage technology to improve efficiency, to execute better data and analytics, whether it's AI, Gen AI, agentic AI, applications that drive productivity for not just selling more, but actually improving the customer experience and improving health outcomes for their customers. So I think that's a big trend. Insurers could definitely do better around network management and making sure people stay within network. Go to hospitals that you have arrangements with, that you have bulk discounts with. So any way that you can improve efficiency or reduce costs is going to help stem that medical inflation over time. Reduce the admin costs, reduce the claims costs, reduce the fraud, waste, and abuse. And again, these are areas where organizations like Synpulse can support and assist with. Sustainability is important. Innovation is important. I think it's an exciting time for the industry. I think the pace of change, the pace of innovation is like never before. And organizations, could use support to go through that journey. So that's where Synpulse is here to help.
Yeah, and of course you, Damian, you're here to help. Really look forward to. I think it's a very important upcoming few years in the health industry. So I hope we can be a bit the change maker and drive the innovation for the industry forward. So thank you for making it today. Of course, people find you on LinkedIn, I guess. Same as us, the Pulse Check podcast. And looking forward to discuss this further with you.
Appreciate it.
Thank you, Damian.
Thanks for your time, Salomon. Cheers.